Good afternoon, everybody. Thank you once again to all of you for joining us for this media conference. I want to start, as usual today, with an update on some of the key statistics in relation to COVID-19 in Scotland. And let me flag up at the outset today that because of some new detail that we are publishing, some of this is a little more complicated than normal, so please bear with me as I go through it. As at 9 o'clock this morning, there have been 4,565 positive cases confirmed. That is an increase of 336 from yesterday's figures. As always, let me be clear that these numbers will be an underestimate. A total of 1,771 patients are in hospital with COVID-19. That is as of last night. That is an increase of 20 on the figures I reported to you yesterday. And within that, a total of 210 people, again, as of last night, were in intensive care with confirmed or suspected cases of COVID-19, and that is an increase of 11 on yesterday. Later today at 2 p.m, further information will be published showing the breakdowns of these hospital and intensive care figures by Health Board. Now, I've spoken before about the way in which we are recording deaths caused by COVID-19. For our daily update figure, the ones which you have heard me give every afternoon at these conferences, we now report on deaths registered by National Records of Scotland, where the individual has been tested and confirmed as having COVID-19. In the last 24 hours, I'm afraid that 70 deaths have been registered in this way, and that takes the total number of deaths in Scotland as of 9 o'clock this morning under that measurement to 366. These figures are the best figures and most accurate figures we can provide on a daily basis. However, as I have said before, in these updates, they don't capture all COVID-19 deaths. So National Records of Scotland, or NRS, are therefore also now publishing on a weekly basis a further report, and the first of these has been published round about half an hour ago. And this new report captures all deaths registered within a 7-day period. That includes those who have died with a confirmed laboratory diagnosis of COVID-19 and also those whose deaths are presumed to be linked to COVID-19. And that means this report also includes cases where COVID-19 is entered on the death certificate as a suspected cause of death or as a contributing factor in someone's death, but where no formal test has been carried out. The number of deaths covered under this reporting system is therefore larger than under the daily system when you compare the two figures on the same date. It is also, unfortunately, almost certainly more accurate. As I say, NRS have published the first of these weekly reports today, and it covers the period up to Sunday, the 5th of April, so 3 days ago. And that report shows that in total, by Sunday, 354 deaths had been registered in Scotland as being linked to COVID-19. Now, you might be wondering why that combined figure is smaller than the figure I've given today of 366 for laboratory confirmed cases. And I want to be clear that that is simply down to a time lag. The figure I've given for confirmed cases is more up to date. But as of the 5th of April, which is the reporting date this week for the combined figure of 354, the number of laboratory confirmed cases as part of that total was 220. Now, I am aware that this all sounds more complex today than usual, but hopefully it will become clearer as the additional reporting system becomes more familiar. And I want to stress that it is all in the interest of providing information that is as full and comprehensive as possible. It's important to stress that these figures record deaths according to the date of registration of death. Now, while this is normally done quickly, within 3 days, there can be a gap of up to 8 days between someone's death and the death being registered. NRS is therefore looking at ways in which, in future, we can also publish information by date of death, although I should say this is more complicated to do. There is one other issue in the figures this week that requires some explanation, and it is again due in part to the transition to new systems for registering deaths. In the week from Monday the 23rd of March to Sunday the 29th of March, registration offices in Scotland were closed at some times as they began preparations for remote death registration during the pandemic. That means that some of the registrations last week would ordinarily have taken place the week before. And that in part explains why the figures for all deaths last week, not just those attributed to COVID-19, are much higher than in the same week in previous years, and why there appears to have been such a sharp increase in overall deaths in 1 week. However, not all of that sharp increase in deaths, which is over and above the numbers attributed to the virus, can be accounted for by that backlog being made up. So this is an issue that we are exploring and studying further. The final point I want to make is that these new weekly figures include more detailed data than has previously been the case. For example, they provide breakdowns of deaths according to health board area, sex and age. These breakdowns show that it is those who are older who are more likely to die of COVID. However, they also show that nobody is immune, that younger adults can also succumb to COVID-19, and everyone therefore should follow the rules to protect themselves and to protect others. And it is important to understand why this information matters. It's not just that we want to count how many people are affected by this virus, although that is of course very important. This information, though, is also essential to helping us to understand who is most severely impacted by the virus, how it has spread and is spreading across the country, and whether there are any hotspots where there are more cases than we would expect to see. It also helps us plan for how many beds we need in our hospitals, and it will help to tell us when the peak of this virus has passed and when we might be able to make decisions about lifting some of these restrictions. I know, and I've reflected on this before at this podium, and it's something I reflect on regularly. It can be really hard hearing accounts of numbers of deaths. And I understand that it can make us feel powerless, that something we can't see or feel is taking so many lives. But we all do have power as individual citizens, and I want again today to stress that. By following the rules, by staying at home, by self-isolating when we have symptoms, all of us can help to reduce the number of deaths. And finally, I've said this on several recent occasions, but I think it is appropriate to say it again. I focus on these statistics in these updates because they are really important to give some overall sense of how the virus is spreading. But I am acutely aware that deaths are much more than statistics. Each and every one of these deaths represents an individual whose loss is a cause of deep grief. So I want again to express my condolences to everyone who has lost friends, family or loved ones. Now, I have 3 other issues that I want to update you on briefly today before I hand over to the Interim Chief Medical Officer and to the Cabinet Secretary. The first point relates to personal protective equipment. We've seen the letter that a range of medics wrote yesterday expressing concern about the PPE they're currently using. And I want to make clear that the Interim CMO will be reaching out today to understand those concerns, and the Cabinet Secretary will be discussing this issue directly with the BMA and the RCN. This is an issue where we will always strive to listen to understand and to address concerns that are being expressed. I understand how crucial it is that health and care workers have the equipment that they need for the environment that they're working in. That's why we issued updated guidance last week. The second related point I want to mention is that the Cabinet Secretary and the Deputy First Minister will join COSLA in a call with trade unions this afternoon to seek to resolve concerns expressed by those who are working in the care sector. Now, we don't think we are very far apart at all from the care sector and care workers on this. It is, after all, in everyone's interest for care sector workers to be able to do their job safely. So I want to stress again that if issues and concerns are raised with us, for example, about the well-being of care workers, we will seek to address these issues fully and quickly. We know how much we owe to workers in the health and care sector all of the time, but particularly now. We are incredibly grateful for everything you are doing for us right now, and we know that we must protect you as you protect and care for us. The third issue and final issue I want to cover is support we've made available today to help students who are facing hardship. A £5 million fund will be made available for this. More than £4 million of it comes from our Higher Education Discretionary Fund and the Scottish Funding Council's Student Support Budget for Further Education, and it will be made available to colleges and universities immediately. Students can apply directly to their college or university for these funds, and I would encourage them to do so. And finally, in these briefings, I often, as I have done today, sadly talk about those who have lost their lives from this virus. But in these really tough times, it's important that we don't lose sight of good news. So I want today to pass on my very best wishes to Daphne Shah. Daphne is 98 years old and she has been receiving treatment for COVID-19 at Ninewells Hospital in Dundee. Note that I said she has been receiving treatment. Daphne has now recovered from this virus and she is back at home. Her recovery is an inspiring and very welcome good news story, but it's also a reminder that even in dark times, there is always light and hope, and I'm sure all of us wish Daphne very well. Now, I'm about to hand over to the Interim Chief Medical Officer, but I want to end by repeating the key public health guidance. Stay at home, except for essential purposes, and do not meet up with people in other households. I know this gets more difficult with every single day that passes, but it remains vital. It is how we slow the spread of this virus, how we give our NHS the best chance to cope with all that it faces, and it is also about how we all work together to save lives. So thank you once again to everybody who is following this advice and doing the right thing. I hand over now to Dr Gregor Smith, the Interim Chief Medical Officer, and then I'll hand over to the Cabinet Secretary.
Thank you, First Minister. I think there will be an understandable focus on the statistics for deaths involving coronavirus today as they're published this afternoon, but what I would like us all to remember is that behind these statistics lie real families who are experiencing loss and grief as a result of losing their loved ones. We owe it to them to be sensitive to that loss, and I want to express my own condolences to those who are experiencing that grief just now. This data helps us to understand better how COVID-19 is impacting across Scotland. Alongside other sources of data, it allows us to understand the characteristics of people who are affected more severely, and this allows us to plan in greater detail. This means that our response to how we help people who present with COVID-19 is very much more focused on those who need most help. We already participate in clinical networks across the UK and Europe to share useful information, and we'll continue to use all the available networks that are open to us to develop learning both in the UK and in our international community. I want to emphasise to you that those links have never been stronger. I'm in regular dialogue with the other UK CMOs in relation to how we learn and develop our approach to COVID-19, and my team are similarly involved in a variety of conversations and committees across the UK and indeed Europe to see how we can improve our approach to COVID-19 as we gain more experience and more evidence as to how we respond to it. So this information is important both to understand the direct and the indirect impacts of COVID-19 and how it's affecting the Scottish population. With that in mind, I want to return to a message that I gave when I last appeared here on Monday. It is really, really important that you understand that if you are experiencing symptoms that make you feel unwell, or urgent symptoms like chest pain or unusual bleeding, is that you are seeking help for those. I want to get across very, very clearly that your NHS remains open to you. I'm in regular dialogue with the Academy of Medical Royal Colleges, and we'll be chatting to them later on this afternoon to see exactly how we can make sure that that message about where and when you should be seeking help is available to you so that it can guide you as to how to approach our health services.
Okay, thank you, Gregor, and I'll now hand over to the Health Secretary.
Thank you, First Minister. I want to briefly touch on PPE again this morning and to repeat that with the First Minister, all of us are absolutely determined to do everything we can to make sure that our staff in health and social care have the equipment that they need to do their jobs as safely as possible. As First Minister said, both myself and the Deputy First Minister will discuss the issue of PPE and its appropriate use in the social care sector with unions and COSLA later today. We are very clear that the guidance allows the use of appropriate PPE, and we want to make sure that we ensure that that is clear for everyone and that the supplies are there and are distributed to them when they need that. I'm also in regular contact and had a conversation yesterday with Scottish Care to discuss, amongst other things, their concerns over the distribution of PPE. We reached a number of important resolutions to some of those, and we are acting on them from yesterday in order to ensure that as the supplies come out from NSS through that new ordering and direct supply route that I've spoken about before, that its destination point is such that care home workers, home care workers and others can access it easily and swiftly. It's also the case that my own officials have a daily call with our unions representing staff in both health and social care, and their PPE is one of the issues that is covered amongst others. And finally, I should say just on this that, again, I will be discussing this to understand the concerns that may still exist for the BMA or the RCN and look to see what more we can do to resolve them. We are absolutely clear that as issues arise, I want to be able to know about them so I can act on them. We have sufficient supplies of PPE now. We have a number of orders already placed coming in weekly. We continue to work to increase that supply chain and make sure that we are confident that our supply can meet the demand that is there. And part of that is also, of course, our work across the 4 UK nations. Again, let me finish by reminding everyone that if you work in health and social care and you have any concern at all that you are not receiving the equipment or PPE that you need when you need it, there is a dedicated email address for you to get in contact with us on that. That email address is all lowercase covid-19-health-ppe@gov.scot, and we'll make sure that that is widely publicised. That email is monitored continuously, it has ministerial oversight, and as soon as issues come to us, we act on them in order to do our very best to resolve this. Our health and social care workers matter to us greatly, and we will do everything we can to ensure they have the personal protective equipment that they need to do the job they are doing for all of us.
Thank you very much, Cabinet Secretary. Can I now turn to the journalists who wish to ask questions? As usual, we've got a large number of questions, so I would appeal to journalists for as much brevity as possible. We'll try to comply with that ourselves and to avoid duplication, and we'll get through as many questions as we can. So first up, I have Lisa Summers from the BBC.
Health Secretary, thank you for addressing the issue of PPE there. I think that the issue that some of the medical professionals we've talked to have around PPE is that they believe that the guidance issued by Health Protection Scotland is for a basic level, and they don't believe that it is adequate to protect them. So what can the Scottish Government do to reassure them that it is? And can they not, or can the Scottish Government not increase production of perhaps more sophisticated supplies of protective equipment so that everybody can have a better level of protection?
Well, can I say, firstly, that the guidance that has been issued is guidance that's been issued on a UK-wide basis by all 4 nations. That guidance was informed by expert input and by the Academy of Royal Colleges. So this is not guidance that governments alone have put together. It has that expert basis to it. There was a concern expressed, I think, at this conference yesterday, and I know it is one of the concerns that a letter that has gone out from the Chief Nursing Officer here makes it seem as if that guidance has been diluted in Scotland. That is not the intention, and one of the issues we want to seek to address in the call that the Health Secretary and the DFM will take part in later on is that if it's open to that interpretation, we want to fix that. In terms of quality of PPE, I set out yesterday the issues that we are dealing with. Supply, distribution, guidance and quality is another one. We are seeking to maximise all of the supply routes for PPE, and we will do that domestically as well as internationally. There are global constraints on these supplies, but we're working hard on that. But we, in all of the work we're taking forward, we are striving to make sure that it is the right quality of PPE and the guidance is right in terms of what workers need to use it in what circumstances. But as long as people have concerns about this, we're in a time of heightened anxiety, understandably. So we will strive day by day to address any concerns that are there so that we can resolve those. A couple of weeks ago, there were concerns from the ambulance service that the Health Secretary worked with the trade union and the ambulance service there to resolve. We will systematically take on these issues and address them so that people have confidence in the PPE they're using. Do you want to add anything to that?
No, I don't think so, First Minister. The only thing in addition I would say is, as First Minister said earlier, the group of individuals who've raised some concerns about the quality of the PPE, although the PPE that we are using does meet the WHO guidelines, as does the guidance itself. That issue, the interim CMO is reaching out to meet representatives of that group to understand what the issues are around quality and to look to see if we can reassure them on that, or if there are, from that discussion, further issues that we need to take up and address. And the absolute assurance from all of us is that where there are issues to be addressed, we will address them.
Okay, Alan Smith from Bauer.
Just a further question on the guidance. We've heard today of One Health Board, which has stopped health visitors and immunisation visits yesterday and today because of what the Health Board has called conflicting guidance. So just further on that, what more can you do to clear up this guidance, and what would your message be to other health boards who are perhaps looking at stopping health visits and immunisation visits, which will be of great concern to a lot of new mums?
I will want to look at more detail of the particular issue you've raised there so that we can address that fully, but I'll hand over to the interim CMO to talk about the importance of immunisation even at this time.
So first of all, I think it's really important to understand that the guidance as it has been formed is, I think, has been made very clear as to that there's a single point of truth in terms of that guidance of where we go to. This formed on a UK basis so that we make sure that there is no misunderstanding between any of the countries. It's all very clearly evidence-based, and it has been agreed after a period of consultation with an awful lot of representative bodies. And important activities like essential immunisation are some of the things that must continue. I'll go back to the point that I made when I was speaking, is that other illness which is there in our society in normal times has not gone away, and it's really, really important that we emphasise that these other protective measures which are there designed to protect the population continue.
On the particular issue you raised, though, about a health board and immunisation, we'll look into that further and come back to you with a bit more detail later on. Peter McMahon, ITV Border.
First Minister, I wonder if you've seen an open letter to you from care workers organised by the GMB union. Those care workers say they do the best for the people they're looking after, but they feel let down by their employers and by their government. They don't feel safe, they're not getting the PPE they need, and they're not getting the testing they think they need. And they say directly, you have lost our confidence. That means you, First Minister, it's an open letter to you. Should you not be meeting directly with those workers to listen to what they have to say and to try and sort out the problems they say they have?
Not only have I seen it, Peter, I actually referred specifically to these issues in my opening remarks because I do take them so seriously. That's why I spoke about the meeting that the Deputy First Minister and the Cabinet Secretary will take part in this afternoon with COSLA and the unions, which includes the GMB. I'm overseeing this whole response. I will meet with whoever I need to meet with, but I think people will understand that on occasion I have to have other ministers directly dealing with some of these issues for me, but there is absolutely no doubt about the focus I have on these issues and will continue to have. So it's precisely because of the issues you raised there that I addressed this in my opening remarks, and we're taking the action that I set out and the Cabinet Secretary has set out to make sure that we deal with these issues. I come back to a point I made earlier on. I know sometimes this can feel like an issue of government on the one side and workers on the other side. But just as we've been reflecting on for obvious reasons in the past 24 hours that politicians are not immune from getting this virus, all of us, I may be First Minister, but I've got friends and family who work in these kind of jobs on the front line of health and care. So I know from my personal experience how vital this is. I'm not standing here just talking as First Minister, I'm standing here talking as the sister of somebody who works on the front line of the NHS, as a human being, as a citizen, I care deeply and passionately about making sure that those who are doing so much for us on the front line get the support and the protection they need. That is why we will tirelessly, issue by issue, concern by concern, work to understand these concerns, listen to them, but most importantly of all, address these concerns. And that's the work that will be getting taken forward this afternoon and no doubt on a daily basis as we go through this pandemic. Fraser Knight from Global.
First Minister, sadly we've heard of at least 14 transport workers in London who have died because of coronavirus. And now they're putting in specific measures to try and protect bus drivers and those who are working in the transport industry. I was wondering, first of all, if you know whether any of the deaths in Scotland are of transport workers, but also if the Scottish Government has been in any conversations with transport providers to try and specifically protect workers in the industry in Scotland? And is the email address for PPE also open to transport workers in Scotland as well?
The email address is there for anybody who wants to use it. Principally, it's been put in place for concerns around health and care, but I don't want to restrict it beyond that. Anybody who wants to raise a concern can use that email address. I'll give it again, covid-19-health-ppe@gov.scot. I don't know in whether any of the deaths that we are reporting today are deaths of people who work in the transport sector. We're trying to provide as much breakdown of these figures as possible, but you will understand that there is a level of breakdown that would breach patient confidentiality that we won't be able to give. We are working with and in dialogue with sectors right across the economy, and any sector that feels they want to talk to us about how workers there can be better protected, the door is open to do that, because we want to understand any concerns and do what we can to address them. But I would take the opportunity here to stress a fundamental point, that unless you have an essential reason for being on public transport, you shouldn't be on public transport, because we are advising people to stay at home. So that is the first line of defence against this virus for everybody, which is the general public complying with the rules to stay at home unless it is essential to be out. So beyond that, we will of course continue to take very seriously concerns of any worker in any sector who are by necessity coming into contact with those members of the public who are out because it is for an essential purpose. David Robertson from the BBC.
Thanks, First Minister. To clarify, it's David Henderson here. First Minister...
Robertson on my list, but I know you're David Henderson.
Well, that's okay. He's no longer of this parish. But let me ask this. Today's release from the National Records of Scotland showed that in the first week of April, there was a very sharp rise in the total number of deaths in Scotland compared to the average for the last few years. The figure is up by almost 650 on the same week in a normal year. Are you concerned that means that the true death toll from coronavirus could be 650 or so in just a week? Are you concerned that could point to a dangerous acceleration of the infection rate, and that there could be a problem with your government's strategy for tackling it as a result of that?
I'm going to hand over in a moment to the interim CMO, but can I say firstly, no, I don't think that would be a reasonable or a safe conclusion to draw. I went into some detail on this in my opening remarks because we are of course aware of and concerned about that overall increase in deaths in the week, the most recent week in which we're reporting, which is an increase in relation to the previous week, but also an increase in terms of the 5-year rolling average of the similar week. Now, some of that, of course, is down to the deaths from COVID-19 that we are reporting today. Some of it, as I have said, is down to the fact that in the previous week, some registration offices were closed because they were adapting to this new system. So some of the deaths that have been reported in that week, registered in that week, will actually be deaths from the previous week. But we don't necessarily think all of that increase is down to these two factors. So we don't yet have enough information to know what the reason for this is. But as I said in my opening remarks, we are exploring that and studying that further, and hopefully we'll be able to have an explanation of that in weeks to come. I'm going to hand over to Gregor, but I think one of the things he will be able to say a bit more about is that this is a phenomenon that is perhaps starting to be seen at this time in other countries as well. So clearly there is something there that we need to more deeply understand. Gregor.
So this is why the breadth of this data is so important at this point in time, so we can better understand exactly what is happening in our communities just now. And although we're aware that there may be some data anomalies which contribute to this, this is a picture that we're seeing being mirrored across countries right across Europe. And it speaks to the point I was making about the importance of actually making sure these links with other clinical and research communities are really, really strong, so that we can compare our experiences to see exactly what might be influencing this change in the numbers from year to year basis. There's undoubtedly more work that needs to be done to better understand this, and there's a variety of potential contributing factors to it. And over the coming days and weeks, I know that Health Protection Scotland will be exploring that in much more detail with colleagues from around the international circuit.
And I would hope that we would be able to give more considered explanation for some of the trends and some of the factors that are at play here. But it is an important issue to have looked at and noticed in these figures, because it's an issue we will no doubt return to. Peter Smith, ITV News.
Hello, can you hear me? Yes. Hi, yes. First Minister, and yeah, just to acknowledge, as you said there, that after we did raise concerns of ambulance workers a few weeks ago, it was addressed, and I know that the paramedics that I was speaking to were very grateful to the response they had from the Health Secretary in your government, so credit where credit is due in that regard. Yesterday, England's Chief Medical Officer conceded that it had been perhaps wrong to end mass community testing here so early in this breakout. And he said that there were lessons that he'd been learning from looking at the German model, which had followed the South Korean model. Are there any lessons that you are learning in your response to this from countries elsewhere to slow the virus and offer us an earlier way out of lockdown?
We look, and Gregor can add more to this, of course we look at experiences in other countries for lessons that can be learned. And when we get to the other side of this, whenever that turns out to be the case, all of us will want to look to learn lessons about what we did and did well and perhaps could have done better. But what I would say right now is, well, two things actually. One of the things I find a little bit frustrating is the difficulty in making direct and reliable comparisons between different countries. I know there is an understandable and to some extent legitimate tendency to do that, but some of the data and the equivalence of the data between different countries, I think, means that there has to be a degree of caution around that. But the second and more substantive point is that we are taking the actions that we are taking right now on the basis of the best scientific and expert advice that we have available. We are all learning more about this virus. We have learned more about it in the last few weeks, and we are continuing to learn more about it. And if that expanding knowledge leads to a need to change our strategy in any way, then that will be done. But the most important thing you said about learning lessons to slow the virus, I come back to my central point here. The most important thing to slow the virus, and this is an approach being taken in many countries across the world, is the stay-at-home message. That we know is the best way of breaking the chains of transmission, slowing the virus, protecting the health service and saving lives. Gregor, do you want to add to that?
I think this just emphasises for me again the need for us to make sure that we're led by the science and the evidence at all times in the approach that we're taking, and that science and evidence is increasing all the time. Our knowledge of this disease started off at the beginning of this year. We knew very little about it, but actually what has happened over the last 4 months is our understanding of how this virus spreads and the impacts that it has in communities has grown exponentially as countries around the world have experienced the effects of it. And again, I emphasise the need for us to make sure that we continue the dialogue with those clinical and research communities to continue to learn from other people's experience, so that we can see what of that evidence applies to the particular situation that we have in Scotland and in the UK, and to make sure that we can apply that when it's necessary to do so.
Okay, thank you. Gordon Cree from STV.
Health Secretary, I appreciate you've said you're doing everything you can, and you've talked about supply and distribution, but what people working on the front line of healthcare and social care will want to know is, how soon from now can they have the PPE in the quantity and of the type that they feel they need?
So I want to be absolutely clear that the supplies of PPE that we have are adequate to the orders that we are receiving and adequate to the need. So when those orders are placed, be it the private sector in social care, be it from local authorities who are delivering home care, then our distribution centre processes those orders very quickly. We have a direct distribution line in terms of the delivery of those orders. So where individual health or social care workers are not receiving what they believe they need, then that is the point of that email address that we've given out. But it's also something that they should be raising with their managers, because there is no reason why the supplies of PPE that we have and that we are responding to the orders placed with us are now delivering, why those should not be reaching those frontline health and social care workers. We occasionally experience glitches in the distribution of those. Where we do, we understand what those are and we resolve them. One of the areas that we have most recently resolved is a pinch point at NHS board level in terms of receiving supplies and then distributing them around the hospital areas that need them. There may be pinch points in terms of social care. We're looking at that very closely today. If there are, we will resolve those. But if there are other areas that people are concerned about, then they need to come directly and let us know. What is not the case is that we do not have enough to supply. Our supplies are adequate for the demand. We simply need to make sure that we do everything we can to ensure that those supplies get to the individuals who need them.
Can I just add a sentence or two to that, just to underline that point? There are millions of pieces of PPE out there right now being used by thousands of health and care workers every day. Where there are issues with supply, distribution, quality, or the content of guidance on an ongoing basis, we want to address those. So it's not about waiting to do it, it's about doing it on an ongoing basis. And some of that will be issues we have to resolve, and some of that has been done already, but we will always seek to do more when we can. But some of it will be about giving confidence to health and care workers that the PPE they are using now is the right and appropriate PPE for the environments that they're working in. And I think that is particularly true, and this is entirely understandable, for those workers who, previous to this virus, have not been used to using PPE in their everyday working lives as much as they are now. Understandably, there is a concern about something that is new or not familiar to them, about whether it's the right thing. So some of this will be about changing our systems where we need to do it, but some of it is about building confidence that the types of PPE that are being used just now are actually appropriate. So we will continue to address this on every level for as long as it takes. So as long as one person out there has got concerns about this, we will continue to try to address that, and that is an absolute assurance that I want to give. Tom Eden from PA.
Thank you, Professor. A University of College London study suggested that school closures have had little impact on slowing the spread of coronavirus. I was just wondering if the Scottish Government has done any work looking at the impact of this policy, and will there be any changes, potentially reopening schools in the near future?
Well, obviously we are doing a lot of work starting to think about the impact as we get more data about the impact of the different measures that have been in place on the spread of the virus, and then starting to think ahead to when and in what order some of these restrictions could be lifted. But I want to be very clear right now on two things, both of which I've said before. One, none of us want any of these measures to be in place for a minute longer than they have to be, and that applies to all of them. But I think all of us want to see kids back in school as quickly as possible. I know parents want to see their kids back in school as quickly as possible, but I think increasingly children want to get back. And we all want children to get back to having a normal childhood where they're not having to live with the kind of restrictions they are right now. But the second point is, it would be wrong of me to stand here and give false expectation around that. When I stood here a few weeks ago and announced, unfortunately, that we had to close schools, I said that parents and children should not expect to be going back after the Easter holiday. I can't stand here right now and say that anything has changed in what I would say there, that schools are not about to imminently reopen. But as we understand more about this, obviously we will seek to get back to normal as quickly as possible. But it would be a really monumental mistake for us to lift these measures prematurely, because all of the hard work people are doing right now would be jeopardised if this virus just got out of control again. So we will continue to be open with people as our understanding and our decision making around these things continues to develop. But I'll repeat the message again today. We are in this for some time yet to come, and people have to be prepared to stick with this in order that it has the impact that we want it to have. Libby Brooks from The Guardian.
Hello, First Minister. If we're acknowledging that there is a likely undercount in both the HPS and the NRS figures that we've got today, would you consider keeping local authority registrars open at weekends just to avoid that time, the problems that we've had with time lag, particularly at weekends?
So if I can just say, one thing I wouldn't want people to think is that there is a systematic undercount in these figures of deaths related to COVID. Obviously, we need to count on tests, but also doctors putting COVID-related issues on death certificates. But what there is, and we talked about this at the weekend in the last couple of days, is a time lag between people dying and deaths being registered, which I think is the question you're asking. So as I said at the weekend, and work has been done on this, we are moving to a system where it will be possible for deaths to be registered at weekends to try to reduce as much as possible that time lag. That said, I suspect we might always see less of a tendency to register deaths at weekends, because people's behaviour will be as it has been for years and years and years. But we want to try and close that as much as possible by making it possible to do that. So that will take place over the next week or two. Tom Peterkin from the P&J.
Good afternoon, First Minister. I've been hearing reports of patients on kidney dialysis who are concerned that there's some form of confusion about the guidelines and their inclusion on the list of vulnerable people. And we're also hearing that Sainsbury's, the supermarket, is still waiting for a list of vulnerable patients so that they can carry out deliveries. I just want to know what you would say to this. Obviously, it's very important that these people are helped who need to be shielded.
Yeah, can I say a brief word or two about that, and then I'm going to hand over to Gregor, who will maybe talk a bit more about the shielded group. There's two groups of people here that I think we often talk about. There's the shielded group, the people who have conditions, in a list that was carefully put together by medical professionals, by the 4 CMOs, and that list is publicly available. All of these people have had letters that give them a text messaging service to register with if they need deliveries of food or medicines. And I know that the first deliveries of those have already gone out. So that's the first group. There is a bigger group of vulnerable people who are not necessarily in that shielded category, but still require assistance. And they may be older people, they may be people with other health conditions that are not in the shielded group, but nevertheless make it more difficult for them to cater for their own needs right now. And over the last few days, we've been doing some work to put in place a service for them. If they've not got friends and family that can help them with these things, there will be somewhere they can go to get assistance with the delivery of food, for example, and we'll be setting out more details of that over the next couple of days. But we recognise the obligation to help people, whether it's with supermarket deliveries, medicine delivery, or anything else that they need. We understand the obligation, first and foremost to the shielded group, but more generally to those within our society who are vulnerable. We don't want anybody to be falling through the net in this, and there are a lot of people in our local resilience partnerships and local authorities in the voluntary sector who are working really hard and making sure that we have these systems in place. Gregor, do you want to say a bit more about the shielded group?
Yeah, I mean, I think it's important to recognise that there are two categories of clinically vulnerable people. There are those who are very vulnerable because of the nature of their immune system's ability to be able to respond to infection with COVID-19. And those people have been given very specific advice around about how they can best protect themselves in their homes and stay safe through this process that has been given the term of shielding. There's then a second group who, although vulnerable, we recognise that degree of risk is not just as high as exists within the first group. And many of them have long-term and chronic underlying medical conditions that still needs attention in some way, that these people still need to be able to seek the medical care that they need when that becomes necessary. And up and down the country, we've got clinicians and specialist societies who are sorting through the best approach to make sure that we balance the need for that medical care and accessing it safely with the ability for people to not put themselves into harm's way.
Okay, thanks, Gregor. Simon Johnson from The Telegraph.
We've been a couple of weeks now into the lockdown, and I just wondered if there was any signs yet, any early signs that we are succeeding in squashing the sombrero.
I don't think I could stand here and say that with confidence right now, and I've been resolute all along that I don't want to, just because I know it's what people want to hear, it's what I desperately want to be saying. I don't want to talk about green shoots before I'm confident that these green shoots are there. I have a very strong degree of optimism that these measures will have an impact on flattening the curve, but we always said they would take not just 2 weeks, but possibly 2 to 3 weeks, and in some cases maybe a bit longer than that, to actually feed through because of the nature of this. A lot of the people that we're now seeing being admitted to hospital, ICU, and sadly dying, would have been infected with the virus before the lockdown measures kicked in. So we have to be patient here. And what I can say to people is, as soon as I feel a degree of confidence that we are beginning to turn the corner, nobody will be more eager and keen to stand at this podium and tell people. And I'm sure that day will come, but it will come quicker if we all continue to stick to the advice that is being given. Chris McCall from The Scotsman.
Good afternoon, First Minister. I'd like to ask about the many Scots, particularly those living in cities who have no garden and are relying on public spaces for access to the outdoors. Given the continuing rising number of infections we're seeing, is it inevitable that our cities in particular are going to follow the example of Paris and begin closing parks and limiting access to outdoor exercise?
Look, I am acutely aware of how tough these measures are for everybody, but I'm even more aware of how tough they are for people who are living in accommodation where they don't have gardens, they don't have access to going outside without going to public spaces. And that's particularly true for people with children. And you know, that's why it's really important as we give the tough advice to people to stay at home except for essential purposes. We do stress that amongst those essential purposes is getting outside, getting some fresh air and getting exercise once a day. And that will mean that people do access these spaces. And I think we want to see people be able to get that exercise. But we need to say to people that when they are outside for these essential purposes, the advice about not gathering in big groups and not gathering in groups of more than 2 outside your household, your own household, remains really important. So again, I know how difficult this is, both in terms of complying with this, but also understanding the boundaries. But the more people comply with this, the quicker we will get to a point where we can be starting to lift this. And I hope we don't have to take more restrictive measures than we're doing just now, whether that's about closing places or reducing even further the essential purposes that people can leave home. But we will increase our chances of not having to do that if people comply with this. So again, you know, I just want to say thank you to everybody, because we are 2 weeks into this now almost, and you know, this is tougher, and it gets tougher with every single day that passes. And my heart goes out to everybody in a tenement flat right now, or in accommodation with no garden, who've got, you know, a kid or 2 or 3 kids. Your life must be really, really difficult right now, and that's why I'm so grateful to you, because you're not just protecting yourselves, you're protecting your community, and you're protecting the NHS, and you're helping us to save lives. So please stick with it, however hard it feels. Rachel Watson from the Daily Mail.
First Minister, just back on the PPE issue, there are reports today about distribution centres being closed and planning to close over the Easter weekend, which seems to be causing, understandably, a lot of anxiety to care workers. I wondered what you thought about this and what the Scottish Government can do if these distribution centres do decide to close. Is there anything the Government can do to help in the supply of that PPE equipment?
I'll hand over to the Health Secretary to deal with that issue, but that will be one of the issues that we are seeking to resolve. I would say the Health Secretary stood here in recent days and talked about GP practices being open over the Easter weekend, pharmacists, she was talking about that yesterday. This virus is not going to go away because it is a holiday weekend, which is why it's important people, even though it's a holiday weekend, stick to the advice, but it's also why we need to ensure that services are there for everybody who needs them.
So we have had those reports too. They came up in the conversation I had with Donald McCaskill yesterday from Scottish Care, and we began immediately to identify where that was planned, where those difficulties were arising, and we're working today to ensure that distribution centres do not close, that their opening hours and their location remains stable, and that everyone who needs to use those distribution centres knows exactly where they are and what their opening times are. And we will ensure that they are not closed over the Easter weekend. As the First Minister said, just as we have asked our GPs and our community pharmacists, we need to ensure that all our efforts remain as robust over the Easter period as they have done up until now and will need to do in the weeks ahead.
Thank you. Vivian Aitken from The Record.
Good afternoon, First Minister. Following on from a point that Peter was making earlier on, the WHO's European Director, Dr. Hans Kluge, said this morning to defeat coronavirus, in addition to social distancing, we need to test more people, do contact tracing and isolate those with the virus. Now, I know what you said this morning about we can't compare country with country, but what Dr. Kluge said was, in Germany, after just 10 days, they are seeing less people with the virus and less people dying. They're increasing the number of tests and they're testing people even with like small amounts of the virus, not very serious amounts of the virus. Should we actually be looking to them and doing the same thing? And if WHO are saying that we should be continuing to contact trace, why are we not doing so?
Well, I've not seen Dr. Kruger's comments. I'll make sure I have a look at them, so I don't want to comment on them. And I don't think it's particularly helpful for me to stand here and talk in detail about what other countries are doing. I'm responsible for what Scotland is doing and the decisions we've taken and the basis for those decisions. We set out at a very early stage the different phases or different strands of our approach to this, where we very clearly would move from a contain phase to a delay phase that we are in. But as I've spoken about in recent days here, we are ramping up our testing capacity. So we are testing more people, and that will continue to rise in the days to come. We have also, and I have also acknowledged, and this is also part of both our testing strategy, but our thinking for eventual exit from these lockdown measures, of the role of testing, tracing and isolating, something that is more akin to a contained strategy as we start to come out of this. So these are all issues that are very much core to our thinking and to our response. Alistair Grant from The Herald.
Hi there. Just to go back briefly to the NRS figures relating to the week between March 30th and April 5th. Obviously, I think as was covered earlier, the total number of deaths registered for that week was 1,741. A difference of an extra around 650 from the 5-year average. And 354 of those are related to COVID-19. Are there concerns that the remaining number, the 289 remaining number of deaths, could be at all related to an overstretched health system as a result of coronavirus, or perhaps people not going to hospital due to COVID-19, whereas they might have done in the past? And can I also just ask, just really, really quickly, and apologies if this has been covered, but is it possible to get an update on how many intensive care beds we have now in total?
On the first part of your question, I think Gregor and I have covered this already. It would be wrong to draw the conclusion that you have drawn right now, not because it is necessarily wrong, but because we don't yet have enough information to say that that is right. What we do know is that we have an excess or a number of deaths in this most recent week of reporting this year that is above the average for the last 5 years and is above the week before of this year. Some of that is down to COVID. Some of that is down to the reporting issues that I spoke about earlier on with delayed registration. But there is another element that we don't think is related to either of those issues, but we don't yet know what the explanation for that is. As Gregor said, this is not dissimilar to something that has been seen in other countries, but we have to do further work and further exploration to understand that better. So as we do that, we will be able to, I think, answer those questions more definitively. In terms of, we have reported here, we've got between 500 and 600 ICU beds, including our surge capacity. I can say today, and I'll put my glasses on so that I'm giving you this figure, that on the basis of the figures I've reported today, when you include our surge capacity for COVID, there are 261 empty available beds in intensive care. So we are not yet anywhere near full capacity in intensive care, but as I said yesterday, we are not complacent about this because we would expect to see the numbers needing intensive care over the next few weeks increase, which is why we continue to be focused on maximising that capacity. Muir Dickey from the Financial Times.
Thank you, First Minister. Just to follow up on Alistair's question there, noticed in the last few days the message from the government stressing that people who need medical care should seek it as normal. Are you concerned that people are dying because they are not seeking medical care because of concern about coronavirus infection or about worries about capacity of the medical system? And if so, what sort of level of concern do you have? How many people could this involve?
So I'll hand over to Gregor in a minute. I don't think it would be correct to say right now that we have enough evidence to say that people are dying for those reasons. But obviously, the fact that this is a message we are deliberately giving reflects the fact that we have a concern that people, understandably, might be less because they know the health service is under pressure. They may, if they feel unwell, just assume it's mild coronavirus rather than be worried it's something else. So there may be a tendency for people to be less likely to come forward to the NHS, and they will think they're helping the NHS. And, you know, obviously that sentiment is one we appreciate, but we don't want people to not come forward if they are worried about their health. Whatever the worry is, whether it's coronavirus related or for some other reason, the health service is still there. Other illnesses haven't gone away because of coronavirus. So again, that message is clear. If you are unwell or feeling under the weather for other reasons, come to the NHS as you normally would. Some of those ways of accessing the NHS are slightly different just now, but it's still there for you. Gregor.
So when I have conversations with clinicians across the country, when I am in dialogue with medical royal colleges, the one thing keeps on coming back to me is that the system feels eerily quiet in relation to people presenting with illness which isn't COVID-19 just now. And that, as a clinician, is immediately disconcerting just now because that illness hasn't gone away somewhere. It exists and people are perhaps making a choice not to present just now because, well, there's lots of reasons, lots of potential motivations why they might do that. I think we've got to be very clear that there are huge risks for people to hold on to symptoms like that. And you know, if they're experiencing urgent symptoms, I've given examples of chest pain or bleeding, but there's numerous other symptoms that people sometimes try to kind of put off and seeking help with. These are things that you should be seeking help for. I want to get the message across very, very clearly to everybody that we as clinicians need to see you when you have these symptoms. We don't need you sitting at home worrying about the odd pains that you've suddenly started experiencing across your chest that you've never had before, or the sense of weakness that you're maybe not sure why it's happened in your hand, or even the bleeding that wasn't there last week but has suddenly started. These are things that we want you still to come and see us about, because we can help you and make sure that if it needs further investigation and further assessment or even further treatment, is that we're getting that treatment to you as quickly as possible.
And remember, the reason why we set up the track for dealing with COVID systems. So if you've got COVID symptoms that you need to seek advice about, you phone the NHS 24111 number, and then if appropriate they will refer you on to one of the assessment hubs for coronavirus. Part of the reason for doing that is so that if you have other symptoms indicative of other illnesses, you can still go to your GP. So if you've got symptoms other than COVID that you're worried about, in hours, phone your GP as normal. If it's out of hours, you can phone the 111 number. But we deliberately tried to separate out these strands so that the NHS was still there to deal with those other kinds of symptoms. Tom Martin from the Daily Express.
Good afternoon, First Minister. I just wondered if we can get an idea from the data we've got so far of what the mortality rate here is, and is that within sort of expectations from the outset, and how is that comparable with elsewhere?
I'm not sure we can answer that question definitively just now, but if anybody can amongst us here, it's Gregor rather than me.
So I guess we're developing a knowledge around about the kind of mortality rates that we're experiencing just now. And across the international communities, those mortality rates appear to be in a kind of similar kind of area. But I think I would say to you that is we need a little bit more information yet before we can really firmly say what those mortality rates are for Scotland or indeed the UK and with a degree of confidence.
I mean, what we would say, and I sort of referred to this in my opening remarks, and I should say to members of the public watching, this publication that we're talking about today, reporting on all deaths associated with COVID-19, is available on the NRS National Records of Scotland website and through Scottish Government channels. It shows that the largest number of these deaths is in the older population, but there are still relatively young people, a smaller number, who have sadly died from coronavirus. So what we would say is that no age group should consider itself immune from this, and that's why it's important that everybody complies with the appropriate advice. Andy Nicholl from The Sun.
Mark, Jason Leach told us that a death toll of 2,000 would be a good result for Scotland. In light of these figures today, are we still on track for that, or are we expecting more?
There is no number of deaths that is a good result. Every death is one that we deeply regret. So we're trying to minimise the number of deaths as far as possible. With any illness, there will be some people who die from it, regardless of the quality of care they get, because of the severity of their condition and perhaps other underlying health conditions. But the reason we're asking people to follow this advice is because it is the best way to make sure that people who otherwise wouldn't die don't die. So I don't want us to have target numbers of deaths. I want us to be working in a way that reduces the number of deaths as much as possible. And again, we've got a big job to do here as government with working with the health service and others on that, but every single person out there can help us with this by complying with the advice that we're asking you to. Mark McLaughlin from The Times.
Hi there. Last night on Newsnight, Mark Wheelhouse, a professor of epidemiology at Edinburgh University, said that testing was the key to get out of this lockdown. Last week, Catherine Calderwood described testing as a distraction. So what is it? Is it a key to get out of the lockdown, or is it a distraction? And I listened very carefully to what you said about testing earlier on, about the capacity and how we've been following the virus and how the virus is leading our response. But is it the case that it's actually our capacity that's leading our response? We simply can't buy enough tests to do the kind of testing we need to do to get out of lockdown.
Well, can I briefly, because these are important issues, but I think it's also important not to conflate different things that are being said. I absolutely, and I've said this several times, as did Catherine when she was standing here, that in terms of its role to play in coming out of the lockdown, testing has a big part to play, and that is absolutely core to our thinking as part of that, and is not the only reason, but is one of the reasons we are seeking to build up our testing capacity. Her comment about distraction, I think it's a bit unfair to counterpose that to that point. What she was saying about a week or so ago was that with all the attention on testing in the here and now, it wasn't that was unimportant, but that we had to take care to ensure that it wasn't distracting us from the other important messages like asking people to stay at home. So while it was important, it wasn't the only thing that was important as part of our current strategy, and therefore it wasn't that testing was a distraction, it was that we had to take care that too much focus on that didn't distract from the other things. So hopefully that makes some sense, and actually both of those things are valid things to say, and we continue to make sure, we've spoken before about the capacity of testing, we have to make sure that we have robust, reliable testing, so quality assuring the labs that are doing it, making sure the tests that we're using are reliable, and that's true of the PCR antigen tests now, but it will be equally true of future antibody testing. All of that is vital, but testing is a key part of what we're doing, which is why we're spending so much time, resource and effort on building up that capacity. Andrew Learmonth from The National.
Good afternoon. Can you tell us a bit more about the formal process for extending the lockdown or reviewing the lockdown? Will you be reviewing it on Monday, which is the 3-week anniversary, for want of a better word? The Welsh Government have today announced that they're going to extend it. Is that something you'd be minded to do as well, or are you waiting to see what the UK Government are doing first?
We're not waiting to see what the UK Government is doing. We'll seek to take these decisions on a four-nation basis. It may be that we all, based on the science and the state and stage of the virus, take these decisions in concert. It may be that the science and the stage of the virus in different parts of the country mean that these decisions are taken at different times. But we will seek to take them based on the evidence, which is why saying will it be Monday or Tuesday, the key thing here is not a date, it's when we've got the evidence that informs the strategy that we take those decisions. I think what the Welsh Government, I haven't seen what the Welsh Government has said, but what I suspect they might have said this morning, which I would 100% echo, is that people should not assume, because this talk of an Easter weekend review, I think has led to perhaps an understandable expectation in some parts that coming out of the Easter weekend, we're going to be lifting these measures next week. I think the Welsh Government today will probably have said that is not the case, and I would echo that. Nobody should be under any illusion that once Easter Monday is by, these measures are going to be immediately lifted. I absolutely wish that was the case, but we do not yet have the evidence that would give us confidence that we're at that stage. Can I thank you all very much for joining us today. Thanks to the journalists who've asked questions, and thank you to all of you for watching. I hope you found today's update useful. I know some of it has been complex given the additional information that we're now reporting, but as I said a moment ago, all of this information is available online if you want to study it in more detail. And can I end just by repeating the email address for anybody working in a situation where they think they should have PPE and don't have confidence that they have what they need. That email is covid-19-health-ppe@gov.scot, and your concern, if you email it to that, will be addressed, and that email, as Jean said earlier on, has ministerial oversight. So thank you all very much, and we look forward to seeing you again soon.